jasmin.com. I am at Bellevie Medical, about to get these lip fillers done. Just kidding. No, I am going to be asking all your nurse aesthetic questions, so stay tuned and I will get those all taken care of for you.
Hi everyone, my name is Jasmin. I'm an aesthetic nurse. My IG handle is at Medical Jasthetics, and we are at Bellevie Medical in Newport Beach, and that Instagram handle is at Bellevie Medical.
Alright, so what is nurse aesthetics?
Nurse aesthetics has a lot of different names: cosmetic nursing, medical aesthetics. It is a not well-defined scope of practices which involve medical procedures that look to treat cosmetic appearance anywhere on the face or body.
All right. How did you get started in nurse aesthetics?
I got started, I first had my lips done, and I had family in the field. I didn't think it was that cool until I got my own treatment, and then I realized how cool it was and how I had to do it myself.
Would you say nurse aesthetics is like a fairly new phenomena, or is it something that's always been around and it's just more popularized now because of social media?
Yeah, totally. I'd say it blew up recently for younger generations. I'd say when Kylie got her lips done, that's when it really blew up. Yes, yeah, that's what did it. And that's what pulled in younger generations. Prior to that, most people are around 40 and up, which is still very young, and it was very taboo. You didn't talk about it. So it has blown up recently, but it has been around for a long time as well, 30 plus years, more than that.
Yeah, and I think social media kind of plays a role in getting people more accustomed to things too.
100%, yeah.
So,
more acceptable.
What type of training or certificates do you need if you want to be an aesthetics nurse?
So it depends on the state that you're in. Here in California, you have to have an RN license if you are in nursing, the field of nursing. And certificate-wise, you can get certificates through different pharmaceutical companies. You can get it through different classes or courses. So it's not very tightly regulated. Very often you're getting trained in a clinic and getting your certificate that way, but certificate is really only for malpractice, to my knowledge. Your learning should come way before that and way after that as well. You really never stop learning.
Okay, so it's not like when you get your BLS or there's no governing board over the whole.
Not quite, yeah. I think they're trying to, but I haven't seen too many steps in one direction to get tighter, more uniform regulation for aesthetic nursing.
Yeah, and I would assume since you're in the business, that's something you kind of keep an eye on.
Yes, definitely, yeah.
Yeah.
And there are a couple different, what do you call them? Like different boards.
Board, yeah.
Yeah, there are different boards, but there's not, one head honcho. There's a lot of different boards, I would say.
Yeah, like there's no American Heart Association.
No, yeah.
Do you have to practice under a physician?
You do. Again, it also depends on what state. Some states you can practice as a nurse practitioner, but in California you do need an MD under the practice name at the very least, and an NP or an MD should be on site at all times.
Okay.
I believe that's what it is.
Yeah, I mean, everyone at home has Google, so you should double check your own research. She's doing her best here. So if someone wanted to get into aesthetic nursing, what steps would you recommend taking?
Yeah, so first you have to go to nursing school. You can get your associates and get your RN license, but usually hiring, it's going to be bachelor's minimum. That's pretty standard, even in bedside hospital. But after you graduate, ideally, my perspective is that you should intern or try to get some experience prior to applying for a position. It's really hard to get hired without any experience. So getting your foot in the door is probably the most difficult thing to do. I have a lot of tips on how to truly get into it, but I say try to get your foot in the door one way or another. There are ways to do that.
Yeah. You want to drop any of these tips? Or?
Yeah. So I would say when I started working here, I've been working with Bellevie for a while, but in the past few months, I started bringing in interns, and not every place is going to be able to do this, but if you go to your favorite practice, wherever that is, and say, hey, I can offer free social media help to grow your practice, or I can, help with patient relations for free if you allow me to shadow or get some experience, act as not an MA, not with a license, but there are ways to get your foot in the door.
Okay.
Just marketing yourself.
Yeah, I think people forget about those kind of
if you want to work in the ICU, I don't think you're really going to shadow too much.
It's trickier in
It is, but if you say like, oh, I volunteered for, this hospital that's looked a little bit more favorably on hiring.
Yeah. So what kind of procedures and treatments do you guys perform?
We do a lot of different procedures here. It's gonna vary based on practice to practice, but here we do different injectables ranging from Botox to fillers, biostimulators, fat dissolving injections. We even do vitamin drips. We do a wide range of lasers, chemical peels, a lot of different skincare treatments, microneedling, cold sculpting. I could go on and on. We have a lot of different treatments that we do.
What would you say are like the most popular, like 3 or 4 of them?
3 or 4, I'd say Botox, fillers, laser hair removal, and I think that's a good 3.
For the Botox, so what areas do people usually get Botox on?
The 3 most common areas for Botox are going to be the 3 FDA approved areas, which are between the brows, up above eyebrows, and crow's feet, or around the eyes. Those are the most common areas, but you can treat a lot of different areas on your face as long as, or if you're treating someone, as long as you have a really thorough understanding of the musculature or the muscle anatomy, then you can treat a lot of different areas.
So what are the things you guys watch out for when you're about to do Botox? Like, what are the no-nos of?
No-nos. I'd say Botox is a very safe procedure, one of the safest procedures, but you want to worry about migration or spread of the product. For example, between the brows, if you get a spread, you can get a ptotic eyelid or droopy eye. It's really common, but upper forehead, you can Spock the brows, you can drop the brows, you can get, it's a Spock brow.
Is that a Star Trek reference?
Yes, it is, it is, but I feel like that's like an industry, that's a Spock brow.
That's funny.
It's ours now.
So if I wanted to get Botox, like how much does that cost? Like if I came in and I was like, I want to get Botox on my eyebrows.
The range, If it's just between the brows, depending on who you go to, if you're going to a plastic surgeon, it's going to be a lot more expensive. Depending on what practice, depending on the price, depending on the area too. If you're in a bigger city, it might be a little bit more expensive. But I'd say anywhere from $150 to even 400 range if it's just between the brows alone. It could be a really wide range. It just depends on what the practitioner is charging, what the practitioner of the practice.
I see. And how long does a Botox treatment last? So if I came in, I got my eyebrows smooth as a egg. How long does it last before my eyebrows go back to normal?
If you are doing an FDA approved dose, or a dose that is appropriate for the strength of your muscles, it should last about 3 to 4 months. If you do a really strong dose, it can last up to 6 months. I don't think it can last longer. My patients like to tell me otherwise, that, it lasted me a year. But their movement comes back. I can actually show you what that looks like. If I make an angry face, I make a pretty strong line between my brows, but it's softer, or not there too much. So about 3 to 4 months, I would say, depending on the dose.
Okay. How many procedures or treatments would you say you do a day? I know you have 2 different
locations. So our Cerritos location, it's very central. We're very lucky to have a pretty strong patient base. So in Cerritos, I might see anywhere from 20 to the high 20s patients a day, which is a lot. It's very busy. Here in Costa Mesa, where it's a newer practice, we don't have a very strong patient base yet. We're working on it. I'm very lucky if I see 6 or 8 patients. That's awesome.
Are you mostly at this facility versus the other one?
I am now, I'm here about 5 days a week, and in Cerritos 1 day a week.
Most of your customers that come in, does their insurance cover the treatments, or is it all out of pocket?
Usually it's going to be out of pocket if you have the most amazing insurance. I've heard of it being covered, but we're not having to deal with any insurance here. We don't. Maybe at a dermatologist's office it might work, but generally a cosmetic procedure, unless it's really altering your quality of life, it's not going to be covered by insurance, unfortunately.
All right. Do you ever have patients who are unhappy with the results, and how do you deal with that?
Totally. It's probably one of the biggest downsides to aesthetic nursing, is that you're going to get a lot of patients who are all over the place, and sometimes it's a matter of educating your patients with expectations. Hey, this can happen, this is normal, come back, we'll always take care of you, kind of a thing. But sometimes you can do your best for a patient and they'll still be very unhappy.
Yeah. Yeah, I imagine that's where the correlation with kind of the bedside manner.
Yeah.
Especially coming in for a procedure that's more usually elective. There's
nothing should go wrong. It should be exactly as I expect it to be, but it is science at the end of the day.
And there's almost like an expectation of like luxury with
100%. Yeah, everything needs to be perfect and seamless, and you're as a nurse, it's not bad for us to let me offer you water, let me offer you coffee, candy, what do you want, let me make you happy.
Because kind of the vibe I got when I walked into is kind of the same feeling when you walk into like a spa or something. Like,
and that's why they're dubbed med spas. If it's a lot of nurses, nurse practitioners, even MDs, it's called a med spa. We like to say medical aesthetics clinic. Again, a lot of different names. So office, clinic, spa.
And I think my last question for you is, so do you have a lot of friends who try to hit you up for free treatments or just things like that? Because I imagine if it's anything like, really anything else, like friends always want a hookup.
Yeah, of course. I have a pretty small circle of friends, so I don't have to worry about that too much. I think it's the same thing as being a nurse. If someone's sick, they're going to ask you for advice, am I dying, what's happening? But yes, of course, usually I'll get those kind of questions, and I'll navigate them differently based on how close we are, a lot of different things to consider.
You want to tell us what some of the machines and equipment?
Yeah, totally. So we do a lot of injectables in here. And here to my left, we have a cool sculpting machine. This is a non-invasive, permanent fat destructing machine. I'd say this is our laser room. This is a laser hair removal machine. This would be our facial room, our esthetician's room, or it can be an extra room if we build up to bring in more nurses. We have another laser in here. This laser is used for skin resurfacing. Actually, if you guys want to do a laser, this is the one I would say.
Oh, yeah. So what is this called again?
This is called Resurfix, and it's minimally resurfacing laser. All forms of skin resurfacing are going to cause controlled injury to the skin to allow the skin to heal better than it was before. So this would be a really good option for scarring, acne scars, a little bit of pigment, but there are some other options that are better for pigment. And we're going to do one pinch. 1, 2, 3, big pump.
All right, hopefully I answered most of your questions, guys. I'm sure you'll let me know in the comment section. But thank you.
Thank you.
Yeah, I appreciate this.